Yeah.
All right.
You guys are
Wait.
You're just doing what I tell you to do.
All right, we're going live, folks.
I know. We're just going like that.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
And our opinion,
In our-
of course, Bob.
All right, we're going live again. Obviously, we're live on Facebook and we're live on YouTube. Our topic today is 7 surprising muscles that can help your low back pain. These are muscles I think a lot of people don't really understand that they actually attach into the back indirectly.
Yes.
And they definitely affect how your back does. They provide stability to the back, and sometimes they can actually throw your back off. They're a little tight.
Right. I think this is what I refer to patients as your own body back belt support.
Yeah, that's a good way of putting it, Brad,
Sure.
because a lot of these muscles actually act as like a binder almost.
Right.
If you have it on, they're going to give you some support. So there's 7 of them, and we're going to go through them all. By the way, if you are new to our channel and you're watching this on the rebroadcast, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, if you're not on Facebook yet, go over there. We are actually going to give away 7 products, Brad, over the next couple weeks.
You mean ones we were just going to throw away anyways?
No, these are nice products. One of them is really nice. It's gonna, I think it's gonna be like $1,000 product.
Oh, really?
I think so. I'm not sure what the final cost is
Can
yet.
I sign up?
Yeah, but no, you can't win.
Oh.
Sorry, no family or friends. So let's start off. So make sure you like us.
Yeah.
And if you're on Facebook right now, give us the thumbs and the hearts.
They
and all
dance
that.
like that across the street.
You like that,
Yeah,
don't
I
you?
do.
Okay, let's start all about the first muscle. The first muscle is the latissimus dorsi. Now the lats, and a lot of people think of the lats being on the side
Right.
here, but they actually, if you turn around, Brad.
You
By
want
the
me to take
way,
my shirt off, Bob, so
no.
they can see my massive muscles?
We don't need to go there, Brad. So,
Right.
but one thing, the lats, they come up and they're a big, wide muscle, and they attach into that thoracolumbar fascia. What we talk about. It's a big, strong band-like material down in the back, and those lats attach into that. The lats tend to do this. If the muscle action they do is they adduct,
Right.
extend a little bit, and maybe internally rotate.
Right.
But the big thing, most people think of it doing this way, don't they?
Right, and they go into that back belt we were just talking about.
Right.
Referring to kind of.
Yeah, they go right into that area that stabilizes the spine.
Sure.
So the more you work those muscles, the more you're going to stabilize the spine.
Right, sure.
So I like to do pull-ups,
Mm-hmm.
which actually works really well in doing those. You can do pull-downs. You want to do these, Brad?
Yes, I do, Bob.
So
The nice thing about doing the pull-ups, you can hang, you put a little traction on your back, which could be therapeutic for a back as
yeah,
well.
Brad and I have talked about that in other videos where actually just the hanging on the bar and then just doing some pull-ups, like you said, provides a little traction and it actually gives you a double bonus.
Right, so I'm gonna, and this is one option. There's a lot of different machines that can provide this, but at home, you can get your TheraBand like this and attach it overhead in some manner and work here. And I'm gonna pull back and down, so you get some posture too, Bob.
Right.
So it's just not one.
Yeah, it's a really good one to do. This is a muscle actually a lot of times you use when you're using crutches, Brad.
Sure.
When you go, if I go like this right now, I'm working my lats a little bit.
Exactly.
Even, as they come in.
But I wouldn't use crutches as a form of exercise.
No. It's just something brought up. Okay, let's next go to the next one, Brad. Next one is the gluteus maximus. And again, now people are going, well, that's a butt muscle.
It is.
And it is, but it also goes up there and it attaches up into that aponeurosis or that.
Oh, you're going into the big words
Yeah,
now.
but kind of into that belt, like you talked
Right.
about, that heavy band stuff. So you kind of get double benefit here. One, it attaches into that material, so it helps with the stability of your back. But also, if your glutes are really strong, when you're lifting, correctly,
Correct.
and what are you going to be doing then? You're going to be putting a little more stress on the butt,
Right.
as opposed to the back. If your butt's really weak and the muscles are really weak, you're relying more on your back.
Sure.
So
it's going to compensate whatever it takes your body will.
a good one to do is obviously just doing some squats. And I like to do the ball on the wall, Brad.
Oh, yeah.
I mean, that's the one that I prefer.
That's a favorite.
We'll just get that out of the way.
Sure.
Are all the cameras, can they all see this, Lonnie?
They can see me, Bob, so don't worry about it.
My wife and I do these together, or not together, we both do these, I
On the
should
same
say.
ball?
That's right.
Wow.
All right.
We don't need to
No,
go
we don't need to
about
know
that,
that.
the family show.
What I like about this, Brad, is it's, now my shoes are a little bit slippery, but especially when you got stocking feet or you got tennis shoes on and you're on carpet, you can keep you want to show how the knees don't go past the foot.
Right.
The front of the foot.
Yeah.
You want to show me that?
Well, some people say that we should be dressing up in more athletic clothing so we could do this, but
I want to look good for people.
right, exactly. We're professionals, and we got to go to work.
Yeah, we got to go to work right after this.
we can't go to work that way.
So, and you can do shallow
right
ones
here.
here.
Go down, Bob. See that? No, do it incorrectly. Bring your feet in.
Like this.
Yeah. Now, if your feet are too close to the wall, look at that.
Now look, my knee's going past the front of my foot.
Right, and then you get stressed the patella, the
I don't know
kneecap.
if we saw that on YouTube too well, but that's fine.
That's we'll get them another time.
So squats are good for you for lots of reasons, but that's one more reason to help the back. The ball also supports your back while you're doing them.
Right.
So it's really comfortable.
It is.
As opposed to doing free squats with weights
If
on
you're
them.
recovering from a back injury, that's a good way to introduce it.
Yeah, it is. All right, next one is, Brad, a muscle that I think a lot of people do not know. It's the quadratus lumborum.
Oh, the QL.
The QL, you're right. It's often called the QL.
We spend a lot of time on the QL in PT school, Bob.
Oh, did you really?
Oh, yeah.
I swear to God, I had one doctor at the Mayo Clinic. He was just obsessed with this muscle. Every time I saw someone with back pain, he would say, strengthen the QL.
Sure.
Every patient.
Yeah.
No matter, that was part of
There
his
was a
formula.
back course that's the whole back pain course was the QL. Everything.
No kidding.
Yeah, the theory was a QL, and we don't want to get into theories and stuff right now, but it's a pretty substantial muscle in the low back.
Yeah, it comes from off the pelvis here, and it can attach into the transverse processes of the lower lumbar spine here. And so it's actually, I think, quadratus because it's kind of got four angles, right?
Right, kind of a square shape.
Right.
If you use your
Somewhat.
imagination.
Almost more of a rectangle, really.
Yeah, well, we don't want to get too.
And it helps hike this hip up. Right.
If you want to hike, this is an important one for people who are dancing. You know what I'm saying?
Sure. Just that one fell flat. But okay, what I often see with a lot of people, Brad, is that their one QL is tight.
Sure.
And that comes from a habit, a lifetime of habits. Let's say.
So if it is tight, you're going to be.
Yeah, you might be bent over a little bit and tighten, or it might hike that one hip and throw things off a little bit.
It might appear like a leg length difference, when in fact it's a quadratus lumborum tightness.
If you tend to sit, like, let's say if you're always sitting in a chair like this, when I sit on a countertop and eat my cereal, Brad, I tend to eat like this. So that would be tight on this QL.
Right. So you'd have to alternate every day.
Right. Or the other thing is, if you lay on one side all the time when you sleep, now this one is going to be probably a little more stretched out, and this one might be a little tight.
Sure. Yeah.
So let's show you a stretch here for this, Brad. One, if you're a younger person, you want to sit kind of cross-leg style here. You could go down like this, and you can just put this arm down here. I'm stretching this side, and I'm bending over here.
So we want this side to be stayed on it. If you can get someone to hold that pelvis down, like
that would even be better.
Yeah.
And I can see it, actually. I feel like I am tighter on this side. To me, anyway, that's what it feels like.
Yeah.
I think an easier way to stretch it, Brad, is to actually get up on like this, and put the arm in. So I'm going to stretch this side here. You can bring your hips forward a little bit, and you just lean into it like this. This really stretches it out. Really easy to do.
If you're having some back pain and you do this and it makes it hurt, don't do it.
Right.
It does stress the back. And
I can really feel that stretching.
Yeah, it's just in the muscle. We want to feel muscle stretching, nothing in the back, nothing in the spine.
If you want to strengthen the QL, there's a couple ways to do this, but one, you can do it on your knees. You can also do it on your feet if you're a little bit stronger, one foot in front of the other like that. And you're just going to hike up like this, and I'm strengthening this side now. Hiking up.
Sure. Yeah.
Hiking up.
That's a tough one for some people.
Hiking up. You can do it actually like this on the knees. It's a lot easier to do it that way, Brad. Well, I can feel that.
Well, of course, Bob. These are strengthening exercises.
All right, next one we're going to do, Brad, is the internal obliques, and we can talk about the external obliques too. These are some of your abdominal muscles, and they come around and they attach into the rib cage, and they attach into that, again, that fascia in the back. We can maybe even throw in the transverse abdominis that one is really like almost a belt around you. It goes all the way around and attaches into the last 6 ribs. And again, that fascia. So all these things, all these work together to form kind of a band around here. So
that's that natural Euro back build that's built in. So that's why core strength, one of the reasons core strength is so important.
yeah, I remember before I was a physical therapist, and a guy I was working with was told I was supposed to strengthen my abdominal muscles to help my back. And I remember not, what is that? Why? How does that work?
Right, exactly.
But now again, if you understand, it goes all the way around and attaches into the fascia.
Yeah.
And if you can keep your stomach and abdomen nice and tight when you're doing lifting and stuff like that, it's going to give you support for your back.
Right,
So,
right, exactly.
let's show a couple of exercises, Brad. Do you want to show the ball ones first?
Yep, exactly. Let me get the ball.
What were you looking at, Brad?
Absolutely.
Oh,
I thought the things were turned down.
oh no, there, I can see the volume okay.
Okay, here we go. This is one of my favorite ones to get the oblique muscles. And if you have, like I got spondylolisthesis, this is perfect for you people. Or if you have some back pain, but it's improving. This supports the back, so you're working the low abdominals. I go like this. My right elbow tries to touch my left knee if we can, and then I go the opposite direction, and we just work it like this.
See, he's keeping the back actually very flat. He's
Yeah.
not. He's not. So, and you got to find out if this is okay for your back or not. Because
Right.
it may hurt. If it does, you don't do it.
Exactly. But I find that the ball really is helpful on maintaining the back in the
Oh yeah, keeping that back flat.
neutral
doesn't it?
position.
Yes, that
Exactly.
makes sense.
The other one, should I use the other one for the ball right
Sure,
away, Brad?
yeah.
This is for, probably more athletic type people. You're a little more agile and aggressive. It's a little more fun, I think. But bring your feet close together. You can do some push-ups in there just for the fun of it. But what we're going to do is rotate and rotate. Keep the shoulders still. And then you can start throwing it in there and get a little more aggressive. And you do this for a number of repetitions, or you can set a timer, go for 30 seconds or a minute, whatever works you until you fatigue. But that's kind of a fun one.
So another one, a variation, if you didn't have a ball, would be to actually, it's kind of somewhat similar, Brad, is you're in this position here, and then you're bringing your legs up like this, like this.
Mm-hmm.
So we're working again the obliques here. You're working the external oblique on one side, the internal oblique on the other side,
Yeah.
right, Brad?
Yeah,
Is that how she
exactly.
works?
Crisscross pattern, that's
Yeah.
why they're there.
Then you can also do a side plank, and you can do it on your knees, or again, you can go on way out to your side. I don't know if I can do it on my side here. And you can go and do these.
Yeah.
These are a little more tough, Brad.
With my
Maybe a
back,
little-
I don't even touch the spondylolisthesis because it hurts. If it doesn't hurt when I'm doing them, it hurts the next day. So caution for people with
So again, you could just start off with this way, which is a lot easier.
Yeah.
But you're right, Brad. You gotta gauge what you're able to do and what you can't do.
Right, exactly.
I'm gonna go right into another transverse abdominis one, Brad. You lay on your back, and you can just do some. You can bring one leg up and then the other leg up. This is a basic one for someone who's just starting out. And then eventually you can do double ones here. Again, I'm keeping my back straight against the mat the whole time. And you can actually throw in the dead bug. And you get your arms and legs into it. And again, that works the abdominals pretty good. I like to do this one too. I get onto my side like this. And I do some side ones like this. And this gets the internal, external obliques a little bit too. And it works out really well. All right, the last muscle group, Brad, that we're going to talk about is actually the rhomboid major and minor, which is our muscles. You might come on over. So, yeah.
Where are we, Bob? I was busy thinking about the comments.
Muscles right between the scapula and the shoulder blades. And you're saying, how is this going to help the low back?
Right.
Well, these aren't strong and you tend to go into bad posture. Yeah, so now he's in bad posture because these aren't strong and they're stretched out. It's going to affect the low back.
All right.
He's rounded here. He's going to be rounded in his low back too. So we want to strengthen those muscles, get you up in the good posture, and that's going to keep your back in good low back in good posture. And a good way to do those, again, the band works out really well for that. You just we have a band at our home that we just have it set up like this all the time, Brad, and we just do some of these.
Right.
And so if I'm this way, you can see I'm squeezing my shoulder blades
Yep,
together.
right here, right there, getting those rhomboids that Bob was just referring to.
Rhomboids, and you actually probably get some trapezius right there.
Sure, yep, we're getting some on the
You can
middle,
go lower,
traps, lower traps.
mid, upper. I mean,
Yeah,
you can
you're
just
probably kicking a little Latissimus dorsi too there.
sure, yeah, little lats.
You just can't isolate one muscle.
So that's the 7 groups. You want to answer some questions here, Brad?
Sure,
Anything on Facebook,
sure.
Melanie?
What about if you had hernia repair?
Hernia repair? Yeah, then you got to kind of go by the guidelines.
I'm
of your
assuming they're
doctor.
talking what kind of hernia, inguinal hernia or a hernia in their
Right,
back.
hernia disc.
Right.
Those are way different.
Right. These are probably should go to a therapist and you approach them one at a time, see what's appropriate for your specific case.
Again, the question was if someone has a hernia, we're not sure if it's a herniated disc or a hernia, inguinal hernia in the groin.
Right.
So
You could herniate in other places too, actually, but those are common.
Lon, you got any other ones on there? Otherwise, they're going to take some off of YouTube now. So
Let's see. I think it's High McDonald asking about retrolisthesis or dextrolisthesis.
again, a lot of them are similar to your spondylolisthesis.
Right. The biggest thing is I don't want to address this. A lot of this is kind of per individual when it gets to those because they're not real common problems. Less common than spondylolisthesis. But if you do these and they create pain in the back, don't do it.
Right.
This is not a no pain, no gain exercise routine. This has to be, muscle fatigue, any pain, particularly in the spine.
No pain at all, even from the beginning.
Right.
And I think, with all those, you're talking about one bone shifted forward on the other, or one shifted back. We're trying to stabilize the spine by, keeping the it all stable like you do have a belt around you.
Exactly.
So, all right. Lonnie, anything over there?
She said she sent it a private message. So
She's sending us a private message. Okay. Again, Brad and I'm going to use this time to apologize. We, Brad and I, again, work full-time as therapists, plus we're trying to do a video a day, and we get hundreds of comments a day. We just can't answer them all.
Yeah, I was trying for a while.
We tried for a long time.
But, getting up at 5:30 in the morning and doing them at night, and it was driving my wife crazy and me too. So we do the best we can.
Yeah. Any other questions?
Yeah, there was, let's see. Oh boy, they're coming in quick there. Oh, hi McDonald, she only said thanks about the.
Okay.
That was it's pretty quick. It's amazing how
Yeah.
it works, isn't it? Oh my goodness.
Brad's really doing well here. We got lots of dead
there's
time.
a lot of people just saying thank you. And it's just nice
Well,
to
thank you. It's nice to talk to everybody. And by the way, if you have suggestions on video topics, again, we don't always respond, but we always quite often read. So if you're saying, please do a certain video type, we often will do it. We may not respond to you and say, thanks even, but we do use it when we're trying to get ideas.
So this is a really good question. It relates exactly to this topic. The person asked about, does hip flexors relate to back pain or can be associated with it? And actually the hip flexors do connect directly to the lumbar spine.
Right.
So yeah, but usually it's because they're tight.
Yeah, the problem is we sit all day long. Most people, a lot of people do, and those hip flexors get tight. So when they get tight, they're going to pull on the lumbar spine a little bit. So when I stand up, it can actually pull me over a little bit. Quite often with people, we have them do the extensions.
So so here we're actually stretching the muscle versus strengthening, which we did on the other
So
side.
hip flexor, usually I'm not worried about strengthening. I'm usually more worried about, so you're stretching not only the back here, when I put my hands underneath my shoulders and go like this, I'm also stretching the hip flexor.
Right. Yep. It gets, so another one of those things you can't.
Yeah, you're getting kind of a double bonus here.
Yeah.
This is really, for most people, probably 80% of the population, this is the exercise we want them doing along with the strengthening.
Sure.
So,
exactly.
And one thing we always say about doing extensions, people think I do 10 times once a day. You can actually do those every hour. That's the thing that people don't realize is you can do them a lot if you're trying to compound or get rid of back pain. Anything, Brad?
Well, let's see, a decompression therapy for the spine. There's a question on that. And I always just like to clarify that when I hear decompression therapy for the back, I'm thinking traction.
Right.
That, and it's just
Exactly.
another word for traction. I think it's.
And now you use the
You can use the inversion
inversion table. We have a video on that. Brad used the inversion table for a number of years.
Right.
And it did help you, and then it stopped helping you.
Right, I had changes in my back, and I think I'm not gonna get into it, but yeah, it should feel good while you're doing it and afterwards for the next 24 hours.
The other
or
thing
more.
Brad said about using the inversion table, don't go all the way. There's no reason to. You could go just partly.
Right.
Because you said you had a headache after you went all the way.
Well, I actually never did it, I just went too,
Almost too.
I just held it too long. I held for 5 minutes the very first time I went on there. And I
That was a
did not
problem.
do that right. You can fully invert. I know they say to on the video for the device I had, but it's not necessary. You're going to get traction without it. You don't have to be the max out person.
There's really some decent units out there for doing home traction now.
Mhm.
That Saunders traction unit,
Right.
we got a video on that. That's
Right.
really, I mean, they're expensive. They're very expensive,
Right.
but they work very well. I had one person who just had chronic back pain, and he would just get on it every night and
Sure.
and pull his back apart a bit.
We've got a video on some other tracks that you don't have to spend money on. It's just doing some things around the house, using
Yeah.
using cupboards or a
Things that you
walker.
can try,
Right,
or two
exactly.
chairs.
Yeah, so Google Bob and Brad lumbar traction. That should come up.
Yeah, it should. So.
Well, a lot of people like to say hi.
Do you guys have a video about IP band stretching?
Yeah, we've done one on, I've been, the question was for Marie, what's her name?
Yeah.
Marie was wondering if we have, and she's on Facebook, and she's wondering if we have a video on IT band stretching. I've been meaning to do another one on that. I think we've done one, but I'd like to do one, because there's like 10 stretches you can do, Brad. We gotta remember to do that,
Which one?
the IT band stretch. And I know we've done it as
Right.
part of videos, but I'd like to do one, just a whole video on stretching the IT.
Yeah, that's a good idea because it's a good one to address.
Yeah. Question?
This is, maybe you know about this one. It's high, again, asking the low back track. Have you heard of that? It was on Shark Tank.
The low back track.
Yeah, it's a device made for the back. Kevin's,
No, I don't remember. I don't recall it.
Okay.
I don't, sorry.
Bob watches a lot more Shark Tank.
Yeah, I
than
watch,
do.
I see all the episodes. I don't recall that one.
Wow,
I'll
okay,
have to look it up again, so.
Yeah, because it's always nice to see what new stuff is coming out.
Yeah, I've seen some stuff that they brought on Shark Tank and they acted like it was new. And it was actually one that we've seen for 30 years. One was the Theracane Brad. They had a different version of it.
Sure.
And another one was the not a chair. You remember how that straps around you?
Oh, right, yeah.
And they acted like they had a brand new one, by the way. It wasn't a new device. I go, that's been around for
Oh, sure.
30 years.
As a matter of fact, I still have an out chair in my closet.
Oh, do you?
We should do another video on it.
Yeah, it's a strap that goes around your back and around your knees and actually kind of supports your back. So it's good for like when you go on a bleacher or something like that.
Right,
And you don't have any back support.
right,
So,
exactly.
do you have a final question or not?
Oh, me or
Yeah.
someone over on?
I just see a couple more pop
Oh,
up here.
man,
Brad.
just coming up.
So we still got some people watching, so we'll maybe take a few more questions here if we can get to them.
Yeah. Well, some of these are very lengthy.
What is it?
So
Line.
you guys have helped me get rid of knee pain and currently getting through Achilles tendonitis. About how long does it take that to through?
So he had this guy. The question on Facebook is he's had knee pain. He's getting through that. Now he's got Achilles tendonitis. The big thing with Achilles tendonitis, you've got to make sure you're doing that massage. And the massage is you're doing cross fiber on the Achilles tendon. But you're not going on the back. You're going on the sides.
Right.
That's where the
That
lesion
pincer
is.
grip,
Yeah, that pincher grip. And you're going back and forth like this. Mine's actually a little sore right now.
Yeah. Well, maybe we should get a little treatment. Let's get some
Yeah.
ice too.
Yeah, but
I
that,
got some new socks, Bob.
yeah, they are actually.
What happened to the gargoyles?
All right, go ahead.
Oh, my
Okay.
gosh.
Any more questions?
There was, someone was asking about, is it okay when they do exercise if their back cracks and they hear it cavitate or makes that popping noise? If you have zero pain, no pain associated with it, chances are very likely you're just fine.
Yeah, and that's almost poppy with every joint.
Exactly.
If it pops and it feels fine, you're usually okay. So,
Exactly.
no.
Boy, it's amazing, Bob. They just keep popping up, and some of them are getting really some nice questions, but they're a little bit longer. It's hard to address them,
Sure.
in a short period of time like this.
I think we're gonna wrap it up here. We've been going for 20 minutes here,
Yeah,
so.
yeah, we got some patients waiting for us
Yeah,
on the
so-
corner here, so.
Thanks for
Take
watching,
care.
everybody.